Vaccine rollout continues. More questions are coming into the newsroom, and we want to answer the questions you've been asking. They are great. Joining us live is Lisa Cuchara, professor of Biomedical Sciences at Quinnipiac University. Thank you so much for being with us.
Thank you.
So we've gotten a lot of questions. Let's get right to it. Evelyn from Brooklyn is asking, do you have to wait any specific length of time to get the COVID vaccine if you already had COVID?
So there's two parts to that question. One is, did you have just a test positive, or were you actually sick and in the hospital with it? So if you have tested positive with it, you do not have to wait any period of time before you do get the vaccine. If you have been in the hospital, then you need to talk with your physician and find out when's the appropriate time. And there might be an instance there where you would wait a little while until you felt a little better. So, but if you've just tested positive or been asymptomatic or had mild symptoms, no, absolutely not. Even if you tested positive yesterday, you could still get the vaccine today.
Okay, good question and good answer. Thank you. And Susanna of East Canaan wants to know, if you have Lyme disease, is it safe to get the vaccine?
So we haven't specifically recruited a population of people that have Lyme disease and tested on it, but there's no indication from the type of vaccine this is, being an RNA vaccine, the way that the vaccine is distributed, or the kind of scientific principle that there would be any contraindication for that. Of course, that's what some of the further studies are going to look at is there a particular population? But if you look at kind of scientific plausibility, this is an RNA going into your cell, into your body for a short period of time, making one protein, going away. So there's no real scientific plausibility that there would be any contraindication for somebody getting that vaccine.
Okay, good to know. This is a question I actually haven't heard before. Patricia of Meriden is asking, can you have the shot prior to surgery? And if so, how many days?
So there would really be no contraindication to getting the vaccine prior to surgery, as with any other types of vaccines. But again, in that particular instance, what is the surgery? You should really consult your surgeon for that. It kind of depends on what kind of surgery and how invasive and intense is that particular surgery. But nothing just right off the top that if you were going to have a minor surgery, that there'd be anything that would be a contraindication for that. But in those cases, always speak to the physician, the surgeon that actually going to be doing the procedure.
Good advice. Lisa Cuchara, professor of Biomedical Sciences at Quinnipiac University. Thanks for making some time for us today. We appreciate it.
Thank you very much, Erin.